And we're going to just talk about what are we going to do here in New Hampshire? How are we going to increase youth opportunity in this context, which we now understand a little better. To help us with this, we have Tim Rourke, our Director of Substance Use Initiatives, and Christina Lachance, our Director of Early Childhood and Family Initiatives. Just a quick side note, one of the most wonderful and privileged things about this initiative is our collective work together and the generosity of so many donors and community members working with us. And we were able to establish Christina's position. It's a brand new position on early childhood at the foundation, thanks to the generosity of the Couch Family Foundation. So we are really appreciative of that. So we're going to give you just a quick example in each of the focus areas we're working in. We have a number of strategies and measures of success. We'll just give you a flavor of that today, and then we'll move on to Q&A with Richard and everybody here. So let's start with early childhood. And Christina, maybe you can just start us off.
Absolutely. So, well, thrilled to be here and really impressed with the foundation and the Couch's investment in early childhood. We know that the science exists now. There's tons of research that tells us how important the early years are. It's a critical time, and it's a critical time to have children in high-quality early childhood centers. And so one of the ways we're going to invest is to increase the number of child care centers, early learning programs that serve our children, particularly our children living in poverty. And our goal is that we can prepare children for kindergarten and for future success in their lives and in their work. We're going to measure this by taking a look at third grade test scores, among other things. We want to see children reading. We want programs that are rich in literacy and in math, and social and emotional health, so that we can have a stronger, more vibrant group of young people entering public school ready to learn and ready to succeed.
It's great. And as we do that, as we look at our measures of success, we'll be looking to see, are we closing the gap? So we won't just be looking at the average for New Hampshire, because in truth, on average, we do pretty well. That's where we're starting from. But what are the third grade reading scores and kindergarten readiness among racial minorities, among disadvantaged children, among all of us as a whole in the different geographies across the state? We'll be digging into that to help inform future work. So let's talk about family and youth supports. How do we keep kids on track and support families as we go along?
Sure. And in this area, the foundation is looking at mentoring. So programs, if you think about programs like Big Brothers and Big Sisters, there's hundreds of children, particularly boys, who are waiting. They're just waiting for a mentor. We know when children have access to mentors, it's more of an informal support, it's a relationship, and it opens many doors for them. Children who have mentors do better in school. There's less disruptive in school, right? We hear about behavior stuff happening with some of these children. They're less likely to use drugs and alcohol. When you think about your own childhood, if your parents weren't coaching you, you had a coach at your sport that was coaching you, or in a club or an extracurricular activity. And so we want to provide those opportunities for children and for young, people approaching young adulthood. And the way we're going to measure that is just by the things I was just talking about. We're going to look and see, what do the suspension rates look like? Are teachers reporting that children are coming to school prepared and ready to learn? Their social and emotional health is good. They're thinking about college, they're thinking about their careers. So a really exciting time for those kind of informal mentorship pieces that oftentimes are forgotten for our young people.
Great, thank you, Christina. Another critical way that we have to work together to keep kids and families on track is addressing substance use disorders in New Hampshire. So Tim, give us just an example of the work in that area.
Sure. And as folks know, as we're in the middle of our opiate epidemic, addiction and substance use disorders are an equal opportunity disorder. However, access to the treatment, recovery, and prevention that is necessary to help our young people stay substance-free often has not been. So the foundation is making major investments in the arena of substance abuse prevention because we understand about addiction two things. It is a children's disease, and the science is clear that it is entirely preventable. So we have been working to make grants to community and regional prevention and public health coalitions to make sure that every community is what Tom McClellan from the Treatment Research Institute calls being prevention prepared, to adopt and implement evidence-based prevention programs that look at the root causes of youth substance misuse in their regions, and to create and develop and implement those programs to prevent young people from beginning use in the first place. We track that through something called the Youth Risk Behavior Survey that is administered in New Hampshire every 2 years. I'm pleased to say we've been actually working in this arena of substance abuse prevention since 2011. And we have seen dramatic declines in youth substance abuse rates in New Hampshire, in part because of a regional, systemic, data-driven approach that we're engaged in as a funder, along with colleagues at the State Department of Health and Human Services and other community coalitions and partners that have been working with us. And we hope to continue to see those declines in youth substance abuse to really shut off that pipeline into treatment and recovery supports down the line if we can lower the number of people who need those kind of higher intensity services.
Great, thank you, Tim. So early childhood care and education, keeping families and kids on track with supports along the way, substance use for those families and kids who need it, and then higher education, education and career. All through Richard's talk, clearly the importance of education, and education that puts you on a path to strong earning power and a good job was hugely important. So for the foundation, we're providing scholarships. We're providing scholarships for lower cost models, for high demand careers that local employers need, for work-based learning and scholarships like internships, apprenticeships that will connect kids to work and help them get through. We expect to see more kids going to college and completing college in high demand careers from this. And ultimately, one of the measures we're tracking is the percentage of our workforce, percentage of our adults in New Hampshire that have a high quality degree or credential. And we want to both see that increase to 65%. We're at about 53% now in the state. And we want to see more of those credentials in STEM related fields, or math, engineering, technology, and science. And that's one of the measures we're using in that. So that gives you just a flavor of the cradle to career actions we're taking together with so many of you, our grantees, partners, and donors. And so I think what we'd like to do, turn it back to you, Mary Jo.
So one of the great things about having Richard here is you can see how much the dots connect between his work and what the New Hampshire Charitable Foundation is doing with New Hampshire Tomorrow. So as you're asking your questions, and I believe there are a few regional advisors or those from the planning committee that had questions, try to keep that in mind, and we'll hopefully hear from both the Charitable Foundation staff and Richard on some of your questions. So anyone with a first question? I know you're out there. Yes, if you could say your name, please. Yeah, I think we have a roaming mic. She's on her way to you. So if you could say your name again and where you're from, that would be wonderful.
I'm Janet Cocchiaro. I'm from the Lakes region. These are all such amazing ideas, and I love all of them. The one piece that I heard Richard talking about that I don't hear the rest of us talking about is the family health piece from birth on. And I'd just like to hear a little bit more about how that would happen. I mean, the mentoring's wonderful, the child care centers are wonderful, but there's that parent-child piece that I'm not sure we've completely addressed.
Great. You want to take it?
Thank you for your question, Janet. I'd be happy to talk about that. And really, I just wanted to quickly highlight at least one of our tactics. But another area, and you're completely right, is the family unit. And so home visiting is another very important piece of the work that we're going to be doing, working with family resource centers that support families of all different socioeconomic backgrounds. Within early learning, even child care centers, ideally as we look to improve quality, and you think about things like Head Start, a component of a really good quality early learning program is home visiting and having a connection with parents and understanding the lives of children in their communities.
Great,
So-
thank you. And just real quick, home visiting is when trained workers go into the home and work with moms, pregnant moms, different families, to help them on how to care for their child or their coming child. We did $90,000 in grants last year, just renewed them this year to 6 or 7 different family resource centers that provide that service across the state. Janet, you're exactly right, we need to do more.
Richard, you were nodding yes a lot. Any additional thoughts?
Just to echo the points about home visiting, the evaluations are ongoing, and I hope we'll get the chance to just say evaluation a lot, because quality evaluation is very often lacking in these places. But I would say we often start these things 0 to 3 or 0 to 2. Really, it should be -1 to 2
Yes.
or kind of 3. It's the health of the mum during the pregnancy. It's the way in which she became pregnant, all that kind of stuff. And so the health issues don't start once the mum gets pregnant. In fact, if you buy anything I said around the contraception, family planning stuff, it starts way before that. So I'm asked sometimes, like, where would you spend if you had $1 billion to spend or something? 2 things. I say pre-sex, post-secondary. Post-secondary education, but pre-sex as well, because I just think in terms of the return on your investment, in terms of dollars, if we could actually help more people to be kind of more planned for. And you came back, right? These are averages. They are. They kind of, and actually the kind of things are by choice. The key thing you said was by choice, right? And my charts don't find that. Most of the people who end up as single parents or in unstable, they didn't choose that. It wasn't a plan. And candidly, if it's a plan, it doesn't really matter so much if there's 1 of you or 2 of you. It might matter a bit economically. What matters is planfulness. Really, that's the issue.
And I appreciated earlier that you said this is something that in America we do not talk a lot about: sex, parenting. Wait, there was a second thing: sex and contraception. Thank
All the
you.
icky stuff.
Right.
And
People don't talk about it.
we're seeing in the addiction space as well, addiction treatment providers who provide services for women, making sure that they're implementing programs that are around reproductive health education, because obviously we have a significant issue in our opiate epidemic with babies that are born drug addicted, very often unintended. And then we've been doing some grant making with Dartmouth, as well as some other hospitals that are looking at providing safe access to prenatal care for women who identify with a substance use disorder, getting them that treatment so that they can give birth to on-time, full-weight babies, and then transitioning them and their baby to pediatric care that can do some of those early childhood strategies, early screening, and family supports to ensure that they get the best start possible, and that becomes the moment where recovery can really help catapult them out of that predicament.
If we can have 2 people raise their hand, oh, wonderful. So that's great. If you can look around and see where the microphone goes next, that's great. Thank you.
Hi. My name's Katie, and I'm from Manchester. And I have a question for Richard about something that you said at the very beginning of your talk about how the people who were either born or made their way into not being in poverty or having money, and how where we choose to live and raise our families and where our children go to school makes a big difference. If you could just talk about that a little more. I live in Manchester, I choose to live in Manchester, and I see people fleeing. We're kind of the biggest city and we have the most poverty. And what can I tell my peers about why it's important that we stay?
I have a whole book on this coming out. So I think that, I'll try and do this quickly. I think that the real break in the biggest increase in inequality is between the top 5th, so people in six-figure households basically, and a bit more right above, and everybody else. There's been no increase in income inequality in the bottom 80% of the income distribution. The bottom 80% of the income distribution are exactly the same today as they were 30 years ago. The inequality has been driven at the top, and especially at the very top. And there's all this "we are the 99% Wall Street" thing. Where's Bernie? He's there, he is. That Bernie made so much of in his kind of run. But I think in some ways that's unhelpful, because a lot of the structural inequalities that we have around education and housing, and I think Bob would say social capital, are actually, that's not just a top 1% problem. That's a kind of us problem, right? And I'm saying us, I don't know everyone in the room, but it's a top 20% problem. And I think that appeals only to self-interest will only go so far. We should make those appeals, but in the end, we have to kind of look ourselves in the mirror and say, look, if we're really serious about this, then how we organize our schools, how we fund our schools. So I live in one of the most liberal counties in the country, but when the school board said there are these massive inequalities in parental contributions to like playing fields and stuff, so we'd like to start taxing them and redistributing that, It was outrage.
We know a little bit about that in New Hampshire.
Right. It was outrage. And it didn't matter whether they were liberal, outrage. It's like, come on. So do we mean any of those things we say around the dinner table? Or do we only mean them when you're not going to come after my money or put poor kids into my kids' school or whatever? Now, up to a limit, or up to a point, you've got to be real about it. But we can't honestly look ourselves in the mirror and say we're interested in the opportunity gap if we segregate ourselves off into affluent school districts where we zone out the poor kids and leave them behind in the city of Manchester or wherever it is, and then read Bob Putnam and talk about it over dinner. You know, there is a point where we have to take responsibility, a bit of responsibility. We have to be willing to pay a bit more and give a little bit more. So that's what. Now, how does that help you with your friends?
It's just a general conversation I have all the time where I'm begging to please people to stay in Manchester because if we leave, it's just going to get worse.
There's a tipping point as well, I think, where it just you find it hard to send your kids. Look, I'm asked this a lot. I'm not going to send my kids to a really poor, terribly performing school. I'm not. I'm not going to treat my own children as a social policy intervention. Right? There'd be something wrong with me as a parent then. But equally, I am going to support a more integrated school. I do want more integrated zoning. I do want my kids to go to a school that's reflective of the society they're growing up in, racially and economically, and I've supported those policies locally, and I will. So that's to a point, but we just need to say, look, what kind of schools do you really want to segregate yourselves away? Maybe you do, but honestly, I don't know the answer. Let's see how my book goes down.
Next question. If you could stand and say who you are.
Yes, hi, my name is Tracy. I have the pleasure of working with Tim on some of the substance use portfolio, and so I in part know the answer to one of my questions. I have two, if that's okay. My one question is actually for Richard, which just helps me to get a frame of reference, because I may have missed it on the slide, but how were you defining in the quintiles rich and poor? I just wanted to get a sense of like what the income was.
Okay, so top quintile is roughly six-figure income households. So once you get into above $100,000 a year householding, that gets you roughly into the top quintile. The bottom quintile is roughly the federal poverty line, which varies by family size, but it's currently, what, 24,000 for a family of four. So that, and actually they do roughly cut off. So I'm saying poor does literally mean poor, and rich means six-figure households. Yeah, those will change over time because they're relative. Right. But right now, that's about what they are.
Got it. Okay. Thank you. And then my second question was just because, in part, I know this answer, but I think it's an important conversation piece, is around the intersection of early childhood and substance use, especially when there are kids, so many kids that I'm sure many of us are seeing or hearing about, who are experiencing toxic stress in their home due to substance use specifically. So I just wondered if you could speak a little bit about that bridge.
I'd be happy to. And when we talk about home visiting and high quality early learning programs, one of those pieces is training our workforce in trauma-informed care services, right? So Dartmouth is doing a lot of work around this. So many of our children are exposed, as you said, to these adverse childhood experiences, a level of stress and trauma that are unimaginable. And so training our workforce to be able to respond to that level of stress is really key. And Katie, to your question from Manchester, I believe it was Katie, right? I've spent the last 3 days with the school principal from Gosler Park School and working around community schools and initiatives. And there's a ton of work that we're doing right here in Manchester and that the Charitable Foundation has invested in to improve neighborhoods and to improve schools and to be working collaboratively with mental health centers, early childhood centers, public school, really bridging all of those groups together to think about how do we best support children's families and communities.
Next question, wherever the microphone landed, and let's just work hard to move it around the room. Great.
I'm Denny Ryan. I'm from Manchester. I'm on the Manchester Regional Advisory Board. The Charitable Foundation's 4 pillars dovetail very nicely with the findings in the Brookings AEI Brookings report. However, the conclusions derived from both of them require significant private and public buy-in. Okay, so I'm a CPA by nature, and this is where some of this is coming from. With budget deficits and spending constraints at every level of government, how realistic is it that public funding can be found to significantly fund these much-needed programs without impacting other programs like defense and safety? And a secondary part of that is, where will the money really come from, and what is the likelihood of it being received?
Katie, do you want to take that?
Sure, no problem.
Thanks for being up here.
Right. So we laugh because we understand our challenges, and that challenge you speak of, Denny, and we also know the New Hampshire way and our tax structure here. So it's no laughing matter, right? But I mean, short version, we'll do it like we always do. It'll be a combination of public and private and corporate and business philanthropy, business contributions to this. I think what's different, Denny, and why we're hopeful is, first of all, the employers in New Hampshire are at the table, and there is an urgency around our future workforce, which we've talked about and so many of you are involved in. That is very real. It is fundamental to our state's future, economic future, like Dick has started us off talking about. So that conversation is, I think, happening in a way that it hasn't before, and the importance of investing in children and even early childhood and the workforce and workforce pathways work is more important than ever and understood, I think, more collectively. So I think that's a positive. And I think, Richard, maybe, I mean, Mary Jo, I'll leave it to you, but in terms of this larger question of public investment, we don't face it only here.
I'd love to say one thing. When you look at that publication and you see the partnerships that are listed from various sectors in that publication, I think it's pretty moving and also starts to describe a pathway to what that relates to your question. Richard.
I think there's two parts to this. One is how much money or what resources can we get. Secondly, how effectively are we spending it? And the first of those, the money is there. It's there at federal level. One of the things we could do is stop giving me massive tax breaks to have an expensive house, to save for my kids' college, etc. The US tax code is extraordinary. The more I learn about it, the richer I get, because I find something else that I can set against it. So the money's there, but it will require us to come back to the question earlier, which is, look, is there a sense that I should be contributing more? I've written elsewhere that there's general agreement that the rich should pay more tax, but nobody ever thinks they're rich. And so even those of us who are actually in quite privileged positions convince ourselves, because our reference point is different, that, well, yeah, I think the rich should pay more tax, but what, me? So good for you. Yeah, I'm rich.
Yeah, I was moved by that in your
I'm rich,
writing.
right? And at what point are we going to start saying, are we always going to define the rich as someone richer than us right now? So I think that's kind of part. So the money is there. It's there federally. I suspect it's there locally as well, and in philanthropic organizations. But this is true of public money and philanthropic money too. It's very often quite diffuse, quite disparate, not very well evaluated. It's not quite clear at the outset what we're trying to do with the money. We're always promised evidence-based policy making, and you as a CPA, I hope, like this. We're promised evidence-based policy making, and what we very often get is policy-based evidence making. Right? We've been pursuing this policy for a while, so you better find me some evidence that it's working, and quite often it's really poor quality evidence. And this is where it gets uncomfortable for local organizations and local institutions, which is that we have favored partnerships, organizations we've worked with for a long time, we know each other, we're maybe in the room here, we're having coffee together, it's all fantastic. But is that money really being used effectively, and are we evaluating it rigorously enough? So I actually think that this is as much about the effectiveness of the resources and the targeting of the resources as much as it is about the amount. It's very hard to stop funding things once you've started to, but unless you do, you don't have a strategy at all.
Where's the microphone? Great. Look at all the hands so we can get it into the next hand, not lose any Q&A time.
I'm Bill Glahn. I'm from the Concord capital region. Richard, your report, I'd be interested in this. A year or so ago when Putnam spoke here, a member of the Democratic National Committee and the Republican National Committee said, we're going to make sure that every politician that comes to New Hampshire discusses these issues. Well, that hasn't worked out so well. I'd be interested in knowing what AEI and Brookings are doing to promote your report in the public policy arena with politicians and others. And secondly, given the fight in this state over things like Planned Parenthood, what are the strategies for building this new cultural norm that you talk about for parenthood and marriage?
Those are great questions. So first, actually, I meant to say answer the last question. And this is a chance to drop in the fact that I had lunch with the Italian Prime Minister this week. I have a great life. I actually realize I've just broken into the Washington elite at the moment when no one cares about the Washington elite. My timing's like, I'm here, but no one's listening to a word we're saying. We're irrelevant. As a part of a big group, whatever. But the reason I kind of raise it is actually he mentioned that in the Italian constitution, for every euro they spend on defence, they have to constitutionally spend €1 on education or culture. It's actually a constitutional requirement. Cool idea, isn't it? But I actually think that the value, we're all talking about the Brookings AEI report. We've done a number of congressional briefings on it. A number of us are asked to talk to politicians about it. I think the value of it, particularly right now, is the process as much as the outcomes. It is the fact that people with very different views on many things can actually sit in a room together and come up with some sensible proposals. And every single one of us, from the furthest left to the furthest right, would, if we could, enact that plan. All right? It's not my plan. It's not what I would do. But if you could would I enact, and actually just say, okay, fine. And we've done some big deals here. All right? There's a bunch of stuff in here I really don't like and wouldn't do myself. But I know there is for you too. And so actually, it's this sort of, in a world where compromise has become a dirty word and where the social norms around that have changed, I think it was honestly the fact of it seems to be as inspiring as the actual kind of policies that result from it. And I was very skeptical about it, I'll be honest. I didn't think it would have much effect. You know, these things rarely do. Anything called a task force basically has no tasks and little force. Working groups don't do any work. You've got a networking lunch, and as someone always said, the difference between networking and not working is just one vowel. So just a general principle, this is where you put stuff just to die. But I honestly think that's so just by talking about it, and every single one of us came out of that having changed our mind about something or shifted our position, or most importantly of all, understanding where our opponents came from. So even as we battled around issues of contraception with some very, very religious conservatives on the group, I came out of there with a better understanding of where they came from. So I just think as a model of how to do business, that's how we're selling it, to be honest, at the moment. And we'll see where it goes. We'll see what happens after the election and so on. I will say, though, that I spend almost no time now trying to influence federal policymakers. That's basically gridlock. I'm much more interested in places like this. I work with Colorado, I work with Delaware, I work in New York City, I'm working in Charlotte, I work with foundations. The action is both politically and empirically much more at a local level anyway. Right? So you can get more done at a local level, state level or city level, and that's where a lot of the levers are anyway. So,
with your interview with Lois Shea at the very end of it, you literally say, if not the community foundations, where else? This is the perfect place to have this work done.
right.
So
That's
I
right.
appreciate it. And that was a great interview, another great read for those of you. We've got one question here, and then if we could bring it over to Senator.
Hi, my name is Carol Robidoux, and I'm from Manchester, and my question comes from the place of a mother of 4, 2 of them being millennials. I think this is a wonderful initiative, and it's great to have a 10-year plan for the future children of America, but we have a lot of kids right now that fall into the gap. I think of them as sort of the Vietnam veterans of this opiate crisis. They grew up in the Great Recession. Their parents lost jobs. They didn't have opportunities to go to college, perhaps, or the money wasn't there. They've struggled to find jobs. They've lost friends to the opiate crisis. They're sort of suffering in a way from post-traumatic stress disorder in some ways. So I think my 2 questions would be, especially with Stay Work Play involved, it would be great to see some sort of program or initiative that does outreach to young people who aren't still in their formative years, but are in a place where maybe they've been to college but have no idea what to do with those skills, and they're work ready and they could be put to work, or how to help them repair some of the issues, the social issues and the economic issues that they face. The second part of the question goes back to this initiative, and I wonder, with all the screen time that kids have and all the technology that's eroded some of the family time that may be at the root of some of our issues in terms of a culture and a society, will there be a technology piece to this that, and if so, if you already discussed that, I'm sorry I missed the beginning, but.
We should start with staff, right?
But it'd be great to learn a little bit more about that if possible.
Thank you for your questions, and we'll lead with staff answering this first.
Okay, just very briefly, it's a great point around the millennials and our young people. We haven't talked about it today, but our overall indicator of success for the initiative is the quality of the cohort of 25 to 36-year-olds in New Hampshire, and what's their education and earning power and connection to work. Those are where this pipeline ends, and those are the parents for the kids who are beginning the pipeline. So we've talked about some of the interim indicators, but we will be watching that. Yulia Spenchek on our staff, who's in charge of evaluation of the initiative, that's her main focus, will be helping us understand how we're doing in that regard and how we can change that over time. So it will be on our radar.
If I could just add sort of two specific examples to your point. In the substance use portfolio, folks may know the foundation has a seat on the Governor's Commission on Substance Use, and I've been serving as that commission's chair. And in December, we are going to have actually a presentation from the Department of Health and Human Services that had received, as a part of a federal grant, spent about a year doing surveillance and focus groups and analysis around youth, young adults, and issues around the impact of substance use and substance abuse prevention resources around young adults, hoping that will inform actually some expanded public policy around how do we do good prevention throughout the lifespan, because typically we target youth, birth through high school, but yet what actually drives New Hampshire's substance abuse rates, which are some of the highest in the country, is substance abuse among young adults. So we're looking at some new data that will, I think, inform some new policy work around how do we address some of the challenges around being a young adult in this state that sometimes have implications around the substance use risk. The second thing I would say specific to media is one of the grantees that we work with through our New Hampshire Tomorrow work in our substance abuse portfolio is Media Power Youth, which is a nonprofit in this state that does education work with middle and high school and elementary students, very specifically on the impact of media on young people's behavior. And they spend significant time in their curriculums, which have been evaluated by Harvard, around technology, social media, not just the impact of commercials and advertising that might be done by the alcohol or tobacco industry, but how does exposure to media actually influence a young person's behavior, and how do we help young people be more media literate to understand that for themselves, but also help parents and families understand how to navigate the new era where technology and social media is so ubiquitous that it is so impactful of young people's behavior, what we can do to address the risks that may come when they have that kind of exposure and miss out on some of those opportunities to go outside and play in the backyard, as I was discussing with someone earlier.
We were both going to mention Media Power Youth as well. Richard, did you have any comments related to this or technology in particular?
The power of media can't be overstated. MTV 16 and Pregnant had quite a big impact on teen pregnancy rates, a lot more than a lot of public policies. Cultural norms, social norms really count. Point one. Point two, we know how not to handle drug epidemics. From the way it was handled for the predominantly African-American communities during the crack epidemic, the 80s and 90s, and the failed war on drugs. If you're being unkind, you'd say that when it was a black problem, we waged war on it. Now that it's a white problem, we're treating it with great compassion. That would be an unkind thing to say. I think that things have moved on anyway, but I think there's some truth to it, is that there's a kind of different reaction. We can certainly unwind some of the failed aspects of the war on drugs, such as the fact that if you have any kind of drug crime, you can't get a Pell Grant to go to college. It's hard for me to think of a stupider public policy to take people with disproportionate risk anyway and then say, so you made a mistake as a youngster, you had a drug crime, I know what we'll do. Let's stop you going to college. Let's stop you voting. Let's stop you. What else? How else can we write? It's both philosophically wrong, but so we know what not to do and how to handle all that. But I think that the mood around the opioid epidemic is very, very different. And if I just put aside my racial point for the moment, I think there's every sign that we'll do this much better. I commend the Foundation's focus on a particular group, 25 to 36, did you say? And I would just reiterate the need to look at gaps. 65% for college or credentials, great, but you might hit that just by getting all your affluent kids through college.
Right.
And I know you know that, but I just keep feeling the need to say it. When we did this in the UK, our success measures were gap measures, not overall measures. it is no good pushing up high school graduation rates just by getting all your affluent white kids to go if you haven't moved up the poor rate or the black or the Hispanic rate. So gaps, 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 gaps. Okay.
Thank you. Senator?
Thank you very much, State Senator Martha Fuller Clark from Portsmouth. And I'm looking at the education and career pathways, and I think it's absolutely essential that we provide the education and skills needed to thrive in the workforce. But I'd like to ask, what are the education and skills that we as adult individuals need to be good community members? And I think it's very important, I think, looking at the idea of STEM, I think it's important to add that A back in for STEAM, and we need to understand that that involves such things as having good communication skills, good writing skills, good reasoning skills, and a much better understanding around civics and what it means to be a community participant.
Katie, before you answer, this is something in the report that we were 49th in. Is that correct? Can you help share that statistic?
Sure.
The STEM one.
Yeah, the 49th was in terms of the number of STEM jobs we need in the state, the number of graduates in the STEM fields that we put out compared to our job needs. We rank 49th in the country on that. So we do need to attend to it. And the local employers have been clear and wonderful partners, and Hypertherm, a leader among many who are working with us on that. And the foundation, well, I mean, Senator, you're absolutely right, and our goal in looking at that cohort is that people will be able to both help drive the economy and support our communities. And in terms of our scholarship work, we'll continue to provide scholarships in all fields while working with employers where there are gaps. So I don't think there's much of an answer other than to amplify your voice and say the arts is woven through everything that we do as a community foundation, and much of that work on the Seacoast you've helped us with, and we will continue that.
Richard, I'd like to let you know that there's many in this audience who serve in public office. So if there was a specific message you would hope to share with those that serve, this might be a good time to do that as well.
So, what, can I say anything?
Well, I know.
Yes, you get to go home tomorrow.
Yeah, that's right.
Didn't mean to do that to
I'll
you. Put you on the spot.
Well, I did have a comment to make on the community civic engagement question, if that's appropriate. Americans remain very civically engaged, certainly by international comparisons. There are widening class gaps on that as well, as Putnam shows. Rates of volunteering, mentoring, involvement in your school, and so on are increasingly divided along class lines. But nonetheless, that kind of civic engagement, sense of wanting to help your community, coaching, being in a neighborhood association, still quite strong, although more divided in the US. I think the problem is how we define our community. And so I might live in a perfectly nice, affluent community, but quite involved. I'm on a subcommittee of my town, my neighbor coaches the high school league, we're all doing stuff. But we've defined our community in such a way that we're just basically helping ourselves and each other's kids. And so the question, and Putnam would say, do you want bonding social capital or bridging social capital? Bonding social capital takes already quite small communities and brings them even more tightly together. Or do you want bridging social capital, which builds connections and networks across different kinds of communities? And so I don't think it's a lack of civic engagement or a willingness to work for your community that's lacking. I think it's an overly constricted view of what your community consists of, which very often stops at the boundaries of your own neighbor. And if we then economically and educationally and occupationally segregate ourselves, which we are doing, economic segregation is rising residentially in the US, then I can feel pretty good about my community involvement. But actually, the more involved I am in my community, the worse the opportunity gap gets. I'm not making it better, I'm making it worse. Because I'm helping the kids who are in my neighborhood who are already doing kind of well. And so I can pat myself on the back about all the stuff that I'm doing, but I just made matters worse. To be clear, from a pure gap point of view, it'd be better if I stayed home and watched TV. Because the kids in my neighborhood don't need any extra help. It's the kids 2 miles east of me or 2 miles south of me that need my help. But do I see them as part of my community? Do the suburbs of Manchester see Manchester as part of their community? Does one bit of New Hampshire see the next bit of New Hampshire as part of its community? Or are you just a bunch of completely balkanized, fragmented communities, increasingly economically segregated, looking after yourselves but not each other? What kind of community is the real question, Senator, I think that we need to be asking.
I wish you could have seen all of your heads nodding about the comment. So yes, that is an issue we face in New Hampshire. And it was hard for me not to make a joke about the infrastructure of our bridges being poor when you were talking about building bridges as opposed to bonding. We need help with our bridges in New Hampshire.
Real bridges
We
as
do.
well.